Hello, doctor. This is MedCognito once again. And today I want us to put some highlights on a very important MCCQE1 objective. And what objective are we going to deal with? We're going to deal with objective 58.1, coma. Objective 58.1, coma, okay? And the main thing I want us to look at will be the Glasgow Coma Scale score. But as usual, before we start, I need you to pay attention. Give me all your attention. This video is going to be short. Put off everything, YouTube, your phone, put on airplane mode, and just pay attention to your computer screen. And let's review this quickly. So, in that particular objective, one of the key things is that you need to determine the level of consciousness using an appropriate assessment tool. So if somebody has some level of consciousness, you have to know appropriate assessment tool to use. And an appropriate assessment tool to use to determine the consciousness level of a patient is the Glasgow Coma Scale score. The Glasgow Coma Scale score. Some call it the GCS score. And a lot of people confuse it, and that's why I want us to pay attention to this. So when do you use the Glasgow Coma Scale score? You use the Glasgow Coma Scale score. It is designed for use in serial assessment of patients with coma from either a medical or a surgical cause. So, for example, the person might have been involved in a motor vehicle accident, or the person may have, may have coded and the person's GCS has just slammed, So these are all the uses of GCS. Now, the GCS has three main components, three main components. So we have the best eye response, the eye. We have the verbal response, the mouth. And we also have the motor response, the limbs. So eye, mouth, motor. Now, the best score someone can score on the GCS is 15/15. And the worst score someone can score is 3/15. Because don't forget that it has three components. The least score on each of the components is 1, okay? But then the highest score on each of the components is different. So that is why we're going to go into it. So with the eye response, the highest score anyone can get is 4. With the verbal response, the highest score anyone can get is 5. And with the motor response, the highest score anyone can get is 6. Okay, so these are the components. Don't forget the best eye response. You're looking for the best. You're also looking for the best verbal response and the best motor response. So let's start with the eye. If the patient opens the eye spontaneously, boom, eye spontaneously, it's 4. If the patient opens the eye due to your verbal command, 3. So, like if you're at the bedside and the patient's eye goes and only opens when you speak, 3. If the patient opens the eye to pain alone, that is the best thing you can do to cause the patient to open the eye. That is 2. And the patient does not open the eye at all. That is 1. So best eye response, highest number is 4, lowest number is 1. Now, best verbal response, highest number is 5, lowest number is 1. So if the patient is oriented, talking to you, oriented to time, space, and person, where are you? I'm in the hospital. What's your name? I am Dr. Brony. What is the date? Or what's the time? Whether it's evening, morning, the patient knows the date, patient is oriented, 5. If the patient is confused, 4. If the patient is speaking words but inappropriate, that is 3. If the patient is using sounds, but you can't really tell, the patient is using all those sounds, 2. And if there's no verbal response, 1. Okay? So that is best verbal response. Now, best motor response, and this is something people miss a lot, and so I'm going to give you a trick. If the patient obeys command, lift up your hand, they lift. Lift up your leg, they lift. Smile, they're able to do it. Good. 6. If the patient localizes pain, so for example, the patient is not opening the eye, but if you apply some pressure, the patient is able to localize the pain. And most of the time, the pressure is applied to the chest, but some also apply to the nail bed and other places. And I'm going to use that as an example. So they localize the pain, that is 5. If the patient withdraws from pain, that is 4. Now, look at the next one. If the patient flexes to pain, usually they call it abnormal flexion to pain. So that is 3. If the patient extends to pain, so you're applying the pain, but the patient is rather extending away, and it is not a typical withdrawal, but it is an abnormal extension, it is 2. And if there is no motor response, it is 1. So what I usually tell people is that for the motor, if the patient obeys command, that is 6. And you realize that it is in 5, localizing the pain, 4, withdrawal from the pain, abnormal flexion to the pain, abnormal extension to the pain, and no motor response. So always remember in, out, okay? That's the best way to remember this. So that is a wrap for GCS. Remember, best motor response, best verbal response, best eye response. The highest amount someone can get is 15/15. The lowest someone can get is 3/15. Now, I want to give you this critical point, this very critical point. So, in a trauma case or in a medical patient with a GCS less than or equal to 8, with a concern that they are unable to protect their airway, or they are expected to have worsening decline in their airway, the answer you need to choose is that I want to intubate this patient. Don't forget that. I want to intubate this patient. So quick one, good luck on your exam. Only keep a positive mind, keep positive vibes. Have a positive life, share the love with the people you love in your life. And let's keep rocking this exam.